nursing student. Can you please tell me your name and date of birth?
Hannah Wallman, 42204.
Okay, and we're going to be doing an ears, nose, mouth, and throat assessment. That's okay.
Yes.
Okay. I'm going to wash my hands. Alright, and now I'm going to note the external ear. Inspect the external ear. Going to look at the pinna and the tragus, as well as the external auditory and hiatus, noting any swelling or redness. Making sure everything is symmetric. Okay, and then I'm going to take the otoscope. I'm going to pull the pinna up and back. And I'm going to be inspecting the ear canal and the eardrum, and also looking at the tympanic membrane, noting the size and the position, making sure it's flat and a pearly white color. Pearly gray, grayish white color. Okay, everything looks good there. Alright, and then I'm going to inspect the sinus area. I'm going to palpate here on the sinus area. Okay, and then I'm going to test the nasal patency. So I'm going to have you hold one nostril closed and sniff up. Do the other side. Alright, everything looks good there. Making sure everything is symmetrical. Nothing, no lesions. Okay, and then I'm going to inspect the septum. Make sure that it's in line. Then I'm going to take my pen line and I'm going to check the nasal mucosa. Making sure there's no lesions or any swelling or excessive redness. Okay, I think it's good there. And then I'm going to test your hearing acuity. So I'm going to stand about 2 feet away and I'm going to whisper a 2-syllable word and I'm going to have you repeat it back to me, okay? Alright.
Football.
Okay, other side.
Baseball.
Okay, and now we're going to take our tuning fork and we're going to do the lever test. I'm going to hit the tuning fork on the palm of my hand and I'm going to put it on the midline of your cranium, and you're going to raise your hand when you feel no more vibrations, okay? Okay, and now we're going to do the Rhine test. So I'm going to hit the tuning fork again, and I'm going to place the end on your temporomandibular joint, which is right behind the jaw. And then you're going to raise your hand when you don't feel any vibrations. And I'm going to move the tuning fork to your ear, and you're going to raise your hand when you can't hear it anymore. Okay? Okay, and now I'm going to check the mouth. Okay, I'm going to have you open and I'm going to check the buccal mucosa, making sure that it is moist and light pink. And I'm checking the teeth and I'm also checking the tonsils. So they're looking normal, so I would rate that as a 1+. And then I'm going to have you say ah.